Okay, an expression that you've heard is watch out for the quiet ones, and that pretty much describes Dr. George Adams, who tends to go about his tasks with surgical precision, no pun intended. He has as many letters behind his name as there are pretty much in the alphabet. He's a scientist, serial entrepreneur, financier. He's been instrumental in founding over 30 companies. He's raised over $100 million, been a director of 10 venture capital funds, 10 startup companies, has 124 scientific publications, has been a reviewer for major scientific journals, federal granting agencies, and centers of excellence, and does have a wife, and I believe he has children, or had time for them. Dr. Adams was president and CEO of the UT Innovations Foundation from 1999 until 2004. Prior to this, he held research and executive positions with Boston Scientific, Pfizer, Corvita Canada, World Heart, University of Ottawa, and the Canadian Red Cross Blood Transfusion Service. In 2007, Dr. Adams received a World Entrepreneur Award at the World Economic Forum in Davos, which I'm sure you heard of, for a lifetime of achievement in bioinnovation and entrepreneurship in the areas, and I hope I pronounced this correct, plasmapheresis? Pheresis, okay. And that involves the removal and treatment and return of components of blood plasma from blood circulation. Also, his award came because of his work with artificial hearts, coronary stents, converting waste grease to biodiesel fuel. So did that have the grease and the heart work, was that tied? Diagnostics and anti-infective coatings. So, why is Dr. Adams president of Ventripoint Diagnostics? It's not because he's bored. You've already heard from two people tonight who were asked by frustrated directors and shareholders to step into the hornet's nest to resolve the business sins of others that came before them. That's what attracted Dr. Adams, but it wasn't just to buy into the frustration. It's because he saw the opportunity, and I'm not going to take his thunder with describing the technology, but he felt it was worth the frustration. I've asked him this question, and he sees a rather substantial opportunity and has very specific things in mind when it comes to the exit strategy. So with that, I'd like to present Dr. George Adams.
I just swallowed something the wrong way here. This could be really entertaining. Oh, thanks, Grant. Let's get started on this. Can you hear me? I can't believe this. So, Ventripoint is about looking at hearts and putting together the dots, connecting the dots to get a really good picture of what your heart looks like. And you'll hear, as I go along, you'll understand that thing the dot thing. Okay. So, the way a physician looks at your heart is they use something called ultrasound. Anybody? How many people here have had an ultrasound done on them? Quite a few people. So they put this goop on your chest, and you use the sound waves to look inside your heart. So this is a picture of what a heart looks like. It's quite blurry. It's actually upside down and backwards. So this is the bottom of the heart, and this is the top. So it doesn't look like a Valentine. It looks like an upside down Valentine. And that's because when this technology was invented back in the 70s and the 80s, they didn't have the kind of slip images around easily, and all the doctors got used to looking at this thing upside down and backwards. And so that's what they do. The problem is you get a blurry picture when you look at your right heart. And the reason is because actually your right heart is your front heart. It's just inside the bones of your chest. And your left heart is behind your right heart. And the sound waves are on a cone. And so when you try and look at something very close inside your chest, you don't have much of a window. It's kind of looking like looking through a keyhole. And you get a blurry picture of the right side of your heart. That's just the way it is. We can't move where your heart is, so the only way the doctor can really figure out how good what your heart looks like is to do an MRI. Anybody had an MRI done on their hearts? No? Nobody? I'm amazed in an audience this big that there's somebody who had a cardiac MRI done. Oh, I've been waiting for a year and a half, said someone in the back, to get a cardiac MRI. Well, that's one of the values of using ultrasound. It's immediate. So the cardiac MRI takes an hour flat on your back in a very claustrophobic MRI machine just to collect the images, the slices of your heart. And then it can take up to another hour of somebody analyzing, drawing pictures and analyzing those images to get an answer for the cardiologist. And what they're looking for is how big is your heart when it's full of blood, and how big is your heart when you've pumped out as much as the blood as you're going to pump out, and what fraction of the blood did you really pump out. That's the three numbers they're looking for. That's what they need to know to decide what to do. It costs anywhere from about $1,500 to $3,000 to do one of these procedures, depending on how complicated a patient it is. And we have started looking at the right heart, and most of the people who have right heart problems are children. So if you're a child and you have to be put in one of an MRI machine for an hour, then they anesthetize you. So to run one of these procedures on a child, you need an anesthesiologist, you need a cardiologist, and you need a radiologist who runs the machine. So you have 3 doctors in the room for an hour just to collect the images and make sure the child's safe. They get paid about $1,000 to $1,200 for this procedure in the United States, so they lose money on every procedure, which is why most of the pediatric hospitals in the United States have large donor populations, a huge development team where they go out and collect hundreds of millions of dollars a year in charitable donations to pay for these kind of procedures, because the government doesn't pay what it costs to do them. Obviously, an MRI costs about $2 or $4 million to buy. And as we just heard, you have to come back for a second visit, and even if it can take a year and a half so long. The average time to go back to get an MRI done, a heart MRI done in Europe, is about 3 months. The average time in a pediatric hospital in Canada and the United States is about 1 month. Obviously, you can get it done tomorrow if it's an absolute emergency, but a routine procedure would take anywhere from 1 to 3 months to schedule. Well, what we do is we take these blurry images and we extract the information out of them such that we can actually get exactly the same information that you get out of MRI. And I'm going to show you that. Dave, can you run the video? Oh, great. So what we do is you put dots on. So you put a dot up here, a dot along the edge, and a dot along these edges, and dots here, until we have a GPS system hooked up to the machine. And so we create this constellation of 24 dots. It only takes 24 dots in three-dimensional space to define your heart. So it's like a fingerprint. You know, you only need 20 or 30 unique features of your fingerprint, and then they can identify it's you. The same thing here. We send those dots to our database, where we have collected over a 5-year period all sorts of shapes of hearts, normal ones and disturbed hearts, and we bring back and we fit the best heart to those points. So actually we take little pieces of hearts and we stitch them together to make a brand new heart, which is as close as we can get to what the heart of the patient looks like. When the doctor looks at it, they can click on any dot and they get the 2D image, which is what they always get to look at, and it shows you, the yellow line shows you where the heart is in that image, and it shows you where the plane is in the three-dimensional object. Cardiologists have never seen this before. They're used to looking at these very flat planes. They don't really often know where the plane that they're looking at in that ultrasound, where that section through the heart is. They've got to guess at where that is. So this is revolutionary for them to be able to see this 2D plane in a 3D object and to look at it. Thank you, Dave. Back to slides. So that's what we do. We extract the information from blurry pictures by using little dots and going to an expert database and rebuilding a model. Next, okay. Oop. Is it accurate? It's absolutely accurate to MRI. You get exactly the same information that you get out of MRI. In this case, it's not an hour in the machine and an hour to analyze it. It's 10 minutes, 5 minutes taking scans and 5 minutes putting dots on the page. It costs about $50 to do that work. In the United States, you get paid anywhere from $100 to $150 for doing a three-dimensional reconstruction on a 2D ultrasound. We sell our equipment for $100,000, and of course every cardiologist in the world has a 2D echo machine. So this is an adapter to their 2D echo machine, which allows them to get MRI-grade information on the patient in the same visit when they first come. We sell them as this. So this, the machine on the left-hand side here, is the 2D echo machine that every cardiologist in the world has. This happens to be a General Electric one. And this is our machine, and there's a wire that runs from that machine to our machine so we can capture the images. And then we have a bed which has the GPS system built into it so that you can locate those dots in three-dimensional space. We started out looking at blue babies. Congenital heart disease, I remember I told you it's a blue baby syndrome, something medically called tetralogy of Fallot. And we are selling that machine now for that particular use. We've got three of them. Our machine is approved in Canada and it's approved in Europe. We've got three machines installed in Canada, in Vancouver, here in Calgary, and in Toronto, and 2 in Europe, in Manchester and in Oslo, Norway, and 6 in the United States. So we've only been at this for about a year, and we have 11 out. We'll have some more out before the end of the year. Next great application is going to be something called pulmonary hypertension. So we all know about high blood pressure. High blood pressure is what you get on the left side of your heart when you grow up and be an adult. You can get high blood pressure on the right side of your heart. It's called pulmonary hypertension, and you get it for the same reason. You get congestion of the blood vessels in your lungs. So your right heart has to push harder to push blood through your lungs. The difference is the right side of your heart is about paper thin. It's not a strong muscle because it hardly needs any pressure normally to push blood through your lungs. On the other hand, you know, the left side of your heart, which has to push blood out to your whole body, that muscle is about a ½ inch thick. So huge difference. So any kind of resistance to blood being pushed through your lungs causes the right side of your heart to go into failure and you die from a heart attack, but on the right side, not on the left side. So there are about 20 million people out there who have breathing problems, COPD, asthma, lung cancer, and all sorts of reasons who end up with pulmonary hypertension, high blood pressure on the right side. We need to screen through all those people and determine who have pulmonary hypertension. We need to do that just in the United States. You'll need about 5,000 or 10,000 of our machines. And so, as I showed you in the picture, we have a 2D echo machine and we have our machine, and they're, you know, it's 2 computers, 2 carts, 2 keyboards, 2 everything. So the real way to access this market ultimately is to put our software on somebody else's machine. So we're currently working on a partnership deal with one of the larger established companies in this field to put our software on their machine, so we can just sell one machine to the people who look after pulmonary hypertension. The pediatric market is about 2,200 machines in North America and Europe, or about $300 million, and the pulmonary market's around 10,000 for about $1.5 billion. So we have about a $1.8 billion immediate market just for these 2 applications alone. We have lots of other applications. We have 11 machines out in hospitals. Every hospital has a couple of cardiologists that are using our machine, and every cardiologist has at least one more thing they want us to build a database for and develop. So we have a long list of applications. So this is like an iPhone. You buy the iPhone and you go to the App Store and you buy another app and you buy another app and you buy another app. So if you're a cardiologist who's looking after people with valvular disease, then you need an application for valvular disease. And when we build that, we'll go back and sell that application to our installed base. So that's our revenue model. We have the same revenue model as GE, Philips, Siemens, and Toshiba, Samsung. Everybody in this market is a capital purchase model. So we sell a machine for $100,000. We charge $15,000 a year for access to the database, phone support for the software, and we have hardware, so maintenance on the hardware. As we sell upgrades and new applications, we'll charge around $20,000 a year on average for new applications and upgrades in the software. And the regulatory agencies have decided that if you haven't used this machine in 3 months, you need to be recertified. So we have an ongoing training protocol, because most of the sonographers, it won't surprise you, most of the sonographers in the world are young women most of them go on pregnancy leave a couple of times, which means they'll be gone for more than 3 months, and they'll have to come back and be retrained. So we'll have a retraining functionality as well. So our goal this year was to put out 10 to 20 machines, and we've got 11 out right now, and we have 4 more scheduled by the end of the year, so we'll be at 15. Next year we're going to put out 50 to 100 machines. We have currently got 230 hospitals in our sales funnel who have indicated they would like to acquire a machine, and so we're now scheduling installations into the first quarter of next year. We anticipate to be cash flow positive second quarter next year, and and grow the company up to a 40 million sales in 2013. But really, we won't get there. You have to realize that we're a small company. Every cardiologist in the world has a 2D echo machine. Every one of them doesn't want to have to ask the radiologist for time on the MRI machine to get their patient on, and so the big guys in the field are going to take us out. So here's some examples. Here's Sentinel Medical. It was a company that was making a better. It was a company that was making a better coil for an MRI machine for breast examinations to look at breast cancer. They built that company up to $15 million in sales, and they were bought last year by Hologic for $335 million. One-trick pony, a slightly better way to use an MRI to do a breast exam. Here's another one, Clariant, which is a cancer diagnostics company. They worked up their way up to $90 million in sales, lost either $10 to $20 million every year, built up a debt of $165 million, still got bought by General Electric last year for $580 million, $5 a share. In recent events, we just finished a financing of $3.5 million at 17 cents. We're currently trading today at 22 cents, so people who got in at 17 a couple months ago are happy campers. We've put in 11 devices. We have, I said, a large sales funnel that's coming along nicely. We started one FDA trial in tetralogy flow to get FDA approval. We're already approved in Europe and Canada, so we're just working on the US right now. And we've got 2 more trials that we're going to start very shortly, one in pulmonary hypertension and a third one in another congenital heart disease phenomenon. That's our value proposition to the customer. That's how we sell equipment. Thank you for listening.